Well, good afternoon. Many weeks ago, Ontario made a decision. Once it became abundantly clear that this would be the fight of our generation, we made a decision as a government, as a province, and as a people. 14.5 million people in Ontario decided to throw everything we have at this fight. We decided to unite around a common cause. We decided that protecting our most vulnerable was worth our best effort. It was worth the sacrifice. We have paid a terrible toll fighting this virus. My heart breaks for those we have lost and the loved ones they've left behind. Our province grieves with these Ontario families. And their loss, their sacrifice, must strengthen our resolve. Because we can't give up, and we won't give up. We won't give up on the most vulnerable, and we won't give up on the brave men and women in the front lines of this fight. I want to personally thank everyone working around the clock at our long-term care homes, retirement homes, and group homes across the province. You're my heroes. You are the protectors of the most vulnerable. Thank you from the bottom of my heart. These workers have our back, and we need to have theirs. That's why last night I issued an emergency order offering childcare services to even more of our essential workers. That includes providing childcare for those who work in group homes, homeless shelters, child welfare, and women and youth shelters. It also includes power workers, water and wastewater workers, those manufacturing our drug and medical supplies, our RCMP officers, our Canada Post workers, and our Canadian Border Service Agency officers. Because looking after their kids while they look after us is just one small way of recognizing their sacrifice. And I want to thank Minister Lecce for his great work. And during these difficult times, I know that many, many parents are concerned about their kids being out of school. Because for our children, education is everything. And no matter what, their education must continue. And that means having the educational tools needed to facilitate online learning. That's why we've worked at a new partnership between Apple and Rogers with our Ontario school boards. We're purchasing iPads at discounted prices for students in need. These iPads will have free wireless data and will help students from low-income families continue their learning safely at home during this pandemic. These students will also be able to access the resources available through our Learn at Home portal. For the parents, I hope this gives you some peace of mind, knowing that your children will have access to the tools they need to continue learning during this very difficult period. Before I hand things over to Minister Lecce, I want to personally thank Uber. They're providing $6 million to Sick Kids Hospital, Daily Bread Food Bank, Trillium Health Partners, and many others. This money will help provide free meals to frontline workers and help support families in need. I also want to thank Bell Canada for donating 375,000 face masks to our healthcare workers and other frontline workers here in Ontario, and for their $5 million commitment to mental health supports through Kids Help Phone, WellCan, and others. Gestures like these and so many others by Ontario businesses, organizations, and individuals show the true Ontario spirit. By having each other's back, we will get through this. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Lecce.
Good afternoon. Our government made a commitment to parents that we would ensure your children remain safe while they learn. We said we would do whatever it takes to ensure learning is universal, accessible, and engaging for our students.
Nous allons tout faire pour assurer la sécurité de vos enfants. We know COVID-19 and this entire situation has created pressures and challenges on everyone, on our parents, our educators, and of course, on our students. It's why I'm proud that the government is taking another step forward to build up the Learn at Home program. You know, folks, we took 2 million kids who were in class in March, and within days, we pivoted to distant virtual learning. Our new teacher-led program is keeping students engaged in learning. And I'm proud of this province, of our ingenuity, of the can-do spirit of our people, doing whatever it takes to support our kids. After all, we launched the most ambitious learning plan in this country, and I know that we have to bridge the gap for those kids that may not have the tools to learn. It isn't their fault, and this government, as the Premier made clear, we've got their back. So from internet access to tablets and iPads, we recognize these are important tools to learn. So today, we're announcing a partnership that embraces the spirit of Ontario, working with respected tech firms of Apple and Rogers and so many local partners, including our school boards, to deliver to those students that need it most. Our partnership will provide iPads, internet connectivity, and the learning software preloaded for families for free for the remainder of the school year. This partnership, supported and led by school boards, will deliver iPads and internet to those that need it most. You know, over 21,000 iPads have been and are being deployed by school boards as we speak across this province to those families in need. This is tremendous progress in a matter of days. You know, students and families will not have to call into Rogers to have their devices set up. So I want to thank Apple, I want to thank Rogers and our school boards and all of our partners involved in supporting our kids in these uncertain times. I've also tasked my officials to expedite the delivery of high-speed internet to schools in this province. And for example, every high school in this province will have high-speed internet by this September. Today, we're also taking action to help those workers on the front lines. We're expanding the list of individuals who are eligible to receive emergency childcare. The list includes critical staff, including workers in developmental services, violence against women's services, Children's Aid Society, women and men who serve in the CBSA and RCMP, among others. These frontline staff members are working with vulnerable populations, so we know they need support. So we're going to continue to support them by providing childcare so they don't have to worry about who's caring for their children when they go to work for us. So effective today, those workers can apply to local childcare centers in your communities. It's a small but important way we can support those that are living, they're putting their own lives on risk so that our families and our children can stay safe. Thank you.
Go to the phone line for questions. First question.
Actually, before we just do the first question, I've always told the public I'd be fully transparent on modeling. I was briefed last night on the modeling, and we've asked our COVID-19 command table to put the modeling out to the public. They said that they'd be able to do it on Monday and get it prepared over the weekend. So I just wanted to tell the people that we looked at the modeling last night, and they'll be able to see it on Monday.
First question.
First question comes from Travis Denrush of Global News. Please go ahead.
Hi, Travis.
Hi, Premier. Good afternoon. Has the medical officer of health indicated to the government that he sees any reasonable likelihood of opening schools before the end of June?
He hasn't as of yet, but as I've always said right from the get-go, we're going to determine when we open it based on health and science, and that's going to be all our decisions moving forward. And as of yet, he has not mentioned it, but we don't want to put our kids in jeopardy. Number one priority is to make sure our kids are healthy and safe. There's nothing more than I know the Minister of Education, myself, we're going to make sure that we see the kids graduate this year, and that's our number one concern. Health, number one, and right after that, making sure the kids graduate.
And Premier, in your remarks, you called long-term care workers heroes, and you said that you want to support them in every way possible. I know that this was one of the points that you had planned to discuss with the Prime Minister on your call last night. Mm-hmm. Will you commit today to increasing compensation for long-term care workers in Ontario, and if not, why not?
Well, we did have that discussion yesterday on the phone. We were getting briefed yesterday, late last night, from the Prime Minister's office, following up today to see exactly what sort of package is available. And we're committing to making sure that we take care of the long-term care workers. But I just want to make sure we're very clear on the package that the feds and the province are going to put forward. But to answer your question, yes, we're committing to that.
Next question.
Next question comes from Richard Southern from 680 News. Please go ahead.
Hi, Premier. Good
Hi,
afternoon. You've spoken eloquently, Premier, and I think all Ontarians have noticed the incredible job grocery store workers have done, cleaners have done, and other minimum wage workers have done through all this. Last year, your government tied the increase in the minimum wage to inflation, and that means it's only going to go up a few cents in the fall. In light of what we've all seen here the last month or so, have you changed your mind on the minimum wage, and will you be hiking it, sir?
Well, right now, I want to thank all the frontline grocery clerks and people that stock the shelves. They're doing an incredible job. And what I'm seeing right now with the grocery clerks, that the private sector, through their corporate companies that they work for, they're above minimum wage right now. So I would, you'd have to ask that question to the CEOs of the big 5 or 6 retail grocery chains, and what I understand, they're above minimum wage right now.
Okay, so you haven't changed your mind on that, Mr. Premier. I take it out. Question for the Education Minister, if I may. Mr. Lecce, have you or anyone in your ministry been preparing for the possibility of no school in September, sir?
Of no school in September?
Yes, is that something you're preparing for?
We're preparing for every eventuality. Our commitment to the people of this province is to ensure dual priorities are achieved. The Premier made clear that your child remains safe and the staff in our schools remain safe and that they continue learning. That's our obligation. We unveiled a program in a matter of days that ensures we achieve that, imperfectly as this situation is for everyone, where teacher-led instruction leads the way, where students are able to see their classmates. For many of them, they're able to interface with their teacher, get that mentorship and that support, and get through the curriculum to graduate that's been already aforementioned. So when it comes to the summer process in September, I want parents to know that we're building a plan for the current school year from now until June. We want to ensure children graduate. We remove impediments to graduation. We support them so that they continue to learn and ultimately achieve all the competencies and skill sets they need to complete their year with integrity. But, if we get the impression that we need to add more supports or take additional measures leading into the next year, we'll do it. We're looking at every option to ensure no child has a gap of learning. And so the Cabinet will be seized with questions and decisions over the coming weeks based on the advice of the Chief Medical Officer. But of course, parents should know we are going to ensure that in no circumstance in the future will this type of difficulty challenge our province. We're going to have a seamless way to go online virtual learning for children in this province so that they don't have to deal with these technological challenges and the growing pains of moving millions of children online.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Laura.
Hi there. My first question is for the Premier.
Yes.
Premier, I'm wondering if you're going to let cities, particularly Toronto, run deficits, not just this year, but in future years, and if this will just postpone their financial problems. I'm wondering if you'll be offering any direct assistance to cities that need money for services.
Well, I know the Minister of Finance. He's been working on a plan. I've had this discussion with Mayor Tory, and Minister Clark as well is working with all municipalities, all 444 of them. I know they're struggling at all levels of government right now are struggling financially based on this COVID-19. And we're going to do whatever it takes. I've said from day one, I won't spare a penny to make sure that we support the people of Ontario, the health and welfare of the people of Ontario, businesses. I'm just zoned in. Number one priority is health over anything. But I'm zoned in on this economy because it's absolutely critical after we get through this and we get the green light. And I want to emphasize we are not rushing into this by any means, but I am zeroed in on the economy with Minister of Economic Development, Vic Fideli, along with our Finance Minister, Rod Phillips, President of Treasury, Peter Bethenfalvey, and a whole team that we're working on the economy. It's absolutely critical. We get the economy, when we're ready, back on its feet.
Thank you. And my next question is for Dr. Fullerton. Minister, the SEIU union is calling for the province to take over Anson Place and Eatonville long-term care homes, and the Ontario Nurses Association is going to court to get proper PPE and isolation policies for those homes, as well as Hawthorne, which are owned by the same company. So will the government put Anson and Eatonville in trusteeship, and how are you addressing concerns over PPE and isolation practices at those homes?
Well, all our homes are able to get the PPE or the personal protection equipment supplies that they need. We have a process in place, a distribution mechanism to get that to them, and that is actually what's being done, and we've improved mechanisms to improve with staffing. The hospital and home care sector are assisting with that. We've got our portals ready to support our homes. Our action plan that we've announced, the protection, prevention for infection, looking at SWAT teams coming into the homes. In terms of a trusteeship, other provinces do things differently than Ontario in terms of who operates homes. In Ontario, the Ministry of Long-Term Care does not operate homes, but we will assist where other companies need to come in and provide resources and support for struggling homes.
Next question.
Next question comes from Alison Jones from the Canadian Press. Please go ahead.
My question is for Minister Lecce. Minister, we've heard from some private child care centres that they are struggling, not obviously being able to charge fees to parents during this time, but still having to pay rent, property taxes, and all kinds of other bills. What is the Ontario government doing to help prevent them from closing during this time, independent of any talks that are happening with municipalities and the federal government?
Absolutely. For context, for families out there, we heard you loud and clear that some child care operators were charging you for a service that was not being rendered because, of course, they were forced to be closed in this province. So we took immediate action. An emergency order was brought forth on the support of the cabinet to mitigate that circumstance so that you can save your money. What we're also doing is ensuring that the sector remains strong, because we know that, as the Premier said, when it is approved by the medical officers, we want to see economic growth and people re-entering the labour market. That is critical to our recovery. And especially for women, childcare is so consequential to their participation in the economy. We are committed to the sector. Indeed, we are working with the federal government. We have been able to work with them, with Minister Ahmed Hussein, to ensure childcare operators are eligible for the emergency wage subsidy, the 75% covering wages. That is critical, and I thank them for that. On our end, we are providing additional support on the operating side that together, between provincial and federal governments collaborating, we believe that the sector will remain strong. And we want to make sure that childcare operators exist in the next 30, 60, 90 days and beyond, because we know it will be critical to ensuring folks and families and workers are get back into the economy.
Are you going to be able to guarantee then that none of these childcare operators will have to close as a result of this pandemic?
Well, what we can guarantee is that the government is providing support. And that we're going to continue to do so, particularly on the operating side, and advocate for you with our federal municipal partners to make sure all programs we unveil can benefit these operators. Keeping in mind we've reduced by 50% off-peak hydro, which benefits so many enterprises and families. We've done a variety of initiatives that we believe in combination is going to really help the viability and the competitiveness of these businesses. Our aim is to ensure the sector remains, that people have access to affordable childcare in their community.
Next question.
Next question comes from Cynthia Mulligan from City TV. Please go ahead.
Hi, Premier. This question is for you. You have mentioned many times that you want to put an iron ring around seniors and in particular long-term care homes, and yet it seems like there's a major crack in the plan, because agency workers are still allowed to go to multiple homes. And I know of one who says he's not getting the proper PPEs. And when he brought his own, he was told not to wear it because there was no case of COVID-19 in the home. Does this make sense to you? And how do you crack down on that and protect agency workers and stop them from potentially spreading it as well?
Well, I'll answer it briefly, but I'm going to pass it over to the Minister of Long-Term Care. Working within the industry itself, they were asking for an additional week to get prepared, to ramp up the staffing. And as for the PPE, we're getting PPE to long-term care homes within 24 hours. I've never heard of long-term care, especially in these times right now, telling their workers not to wear PPE. Again, as I did before, Cynthia, I'll follow up with the home and call me offline and find out what's going on. I just, you know, I believe your story, but I always like getting both sides of the story and find out who would say something like that, because that's ridiculous. Everyone working in long-term care home has access to PPE, and I highly recommend that they wear it. But I'll pass the balance over to the Minister of Long-Term Care.
Thank you. So in terms of the agency workers, a very, very small percentage of workers in long-term care are through agencies. And what we've implemented with the emergency order, one location for long-term care for our frontline workers was a necessary step. And the agency nurses were not included in that because we know that during the transition time, while our homes change to that policy and while our workers have to decide on where they're going to work, we wanted to make sure all homes had necessary staffing. And so the agency nurses are a supply of support to our homes, and it is an imperative that we have access to staffing right now. We cannot allow any home or the residents to go without the care they need. In terms of the PPE, or the personal protection equipment and masking, the universal masking requirement went out by the Chief Medical Officer of Health. It's clear that people working in long-term care homes should be wearing the masks and have access to PPE. If there's anything like that, we have an action line, we have complaint lines, and we're keeping in touch with all the homes who are having risk evaluated. Homes that may be at greater risk of staffing issues or PP issues, we're on that. We know who they are, and if there's others, we need to hear about them. Thank you.
Okay, Minister, I'll follow up with you. Yesterday, I asked the Chief Medical Officer of Health how many residents who were COVID-19 positive were transferred to hospitals, and he said that that is not being tracked, and he believes the number is very few. Why wouldn't you track that?
Well, first of all, when people go to long-term care, they have complicated comorbidities or illnesses that are often combined. They are the frail of the frail. And often when at that point in life, there is a discussion about what they would like. And many people choose not to go to hospital. Those who want to go to hospital or whose family want them to go to hospital, they will be taken to hospital. There is no room for ageism. I've said that before. These people who want care will get the care they need. But many people decide with their families that the more appropriate place for them is in their long-term care home.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Premier, you mentioned off the top about releasing new modeling on Monday, but I'd like to ask you about where things stand now. Based on the modeling that was released earlier in the month, we should be at about 1,700 people was the worst case scenario, we were told, in ICU. The best case scenario was about 1,200, when in fact we're at about 245 in ICU as of the numbers released this morning. 478 deaths, all of those regrettable, but nowhere near the 1,600 we were told was the likely outcome based on the current situation. So what are you being told? How do you read it? Was the modeling off, or is this a function of social distancing and the other measures that you've brought in working?
Well, I'm going to pass this over to the Minister of Health, but I think with the support of the 14.5 million people and the measures that everyone took, not just the government, I give all the credit to the people in this province. They practice social distancing and self-isolation, and the results are positive. I'll never say they're good, I'll never say they're great, but they were very positive for the public sector. But long-term care, we do have a challenge, but I'll pass this over to Minister of Health.
Well, of course, the details of the modeling will be presented on Monday, but of course, we had to prepare for the worst case scenario. We needed to build up hospital capacity, which we've done. We have about 200 people in intensive care right now on ventilators, but we are able to deal with many more. We hope that we don't need to. But as the Premier indicated, it's really because of the efforts of the people of Ontario, all 14.5 million people, practicing physical distancing, staying at home, self-isolating within as required for 14 days when coming from another jurisdiction. All of that has made a difference. All of that has saved thousands of lives, and I'm very, very grateful to the people of Ontario for doing that. We know that we need to continue with this, but it is because of all of those efforts that we are in a situation where our hospitals can deal with the number of people coming in, and now what we need to do is work on long-term care and make sure that that very, very vulnerable group of people is protected.
And Premier, I'd like to ask you what your message is for the people of Ontario as we head into the weekend. It's going to be nicer. You've talked in the past about making sure that people aren't out packing the streets or the beaches or going to their cottages. What do you say to them as we're looking at a much nicer, warmer weekend? And to the Minister of Education, has he considered following what Quebec is considering, which is opening up the schools so that children can become infected and develop a bit of herd immunity to COVID-19?
Well, I'll answer the last question right off the hop. The answer is no. We aren't sending our kids back into harm's way until we get the green light from the Chief Medical Officer of Health and the command table. It's not worth it. We aren't going to chance risking our children and their health, and so we're going to be making sure that we're very, very clear on that, Brian. Yep.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hello, everyone. I guess this is best put to Minister Elliott. Just wondering, the City of Toronto has developed its own, is developing its own COVID-19 database because they consider the provincial one outdated and clunky, which we all know it's a bit on the slow side. Apparently, it's very cumbersome for health units to input their data, and the results are much later than they should be. So, is the province looking at any upgrades to its 15-year-old IFIS system?
Absolutely. We're looking at upgrading all of our systems. We want to have a nimble system that's ready to go. And I think it's going to be really important for the City of Toronto to share that data with us, which I'm sure they will do, because this is a database that's going to be really important for us in the future to be able to analyze, to understand the triggers for COVID-19, to understand exactly what happened. We need to learn from this as we learned from SARS, but absolutely we want to update our technology. That's really important. We want people to use the virtual tools just as we have developed the virtual tools for people to visit their doctors by developing the K codes for OHIP. So we're going to do the same thing with our public health system.
Okay, and as a follow-up, how long is that going to take? When are we going to see this?
I can't give you an exact date, but I can tell you that many things are working in tandem right now, that this is something that we know we need to prioritize, and we are, because this is data that is going to be very, very important, both now and in the future.
Next question.
Just right before
Next
we
question.
start,
Sorry.
I apologize. Before we start the last, I want to apologize to Brian Lilly. I didn't answer his first question. What is the message? And it's a very good question, Brian. What is the message from our government about this weekend? We've come such a long way, and it's been a real fight, and everyone has contributed. And please, just again, continue practicing social distancing. Don't be traveling up to the cottage. It's still a heavy burden onto the people up in the northern areas and in cottage country. So let's continue practice social distancing and self-isolating. I know it's tough. I know it's hard to do, but we've come such a long way, and we saw some positive results last night, and it's encouraging, but by no means are we out of the woods right now. So sorry I didn't answer the first question, Brian. We'll take the next question.
Next question comes from Colin Dimlow from CTV News. Please go ahead.
Hi, good afternoon, Premier. Thank you for taking our questions. Can you tell us more about yesterday's conference call with the Prime Minister, specifically on steps to reopen the Canadian economy? I know you want to take a measured approach. I know you want to strike a balance between firing up the engine, keeping that second wave at bay, and you want to take the advice of the Chief Medical Officer of Health. But can you give us a sense of what this looks like when we do reopen? Is it going to be in stages, or is it all going to be at once?
Well, it'd be in stages, and the Prime Minister on the phone with all the premiers, he recognizes that every part of this country is different. BC's a little ahead of us because it hit them first, and they'll probably start off. I know Alberta, they wanted to move forward very cautiously, but we're going to do this in a methodic way, in stages, when the time comes, and we're going to make sure that we consult with industries right across this province, and making sure that it's very clear when we do the rollout. But I am calm. I'm telling you, I'm zoned in. I have my health experts behind me and at the COVID table. I have my education expert, but we have some great industry leaders and business leaders and economic leaders that are going to support us in making sure that we do this correctly. But once we get going, we're going to be firing on all cylinders, and we're going to be there to help the businesses that have been struggling, because it's been terrible for so many small businesses and really all businesses. And I'm just zeroed in on making sure we get the economy going when the time is right, and do it methodically. Move it out very slowly and cautiously. We aren't going to be out there opening up the floodgates, but once we get going, it's full steam ahead.
All right, thank you, Premier. I have a question for the Health Minister as well. Minister, doctors currently are saying that they do not expect to get paid for virtual care services until mid-June. I'm wondering if the government will allow doctors to use the regular pre-pandemic billing code so that they can get paid until those computers accept the new codes. Many doctors obviously have bills, rent, staff to pay a lot of overhead. Will you allow them to use the pre-pandemic billing codes?
Well, we have been dealing with doctors, dealing with the Ontario Medical Association for a long period of time. We have made changes to the OHIP codes, the K codes, so that they can do phone consultations with their clients. We expect that will continue in the future. We've also had an agreement with the Ontario Medical Association to change some of the billing systems for doctors, so that if we're working in intensive care or working in emergency departments with COVID-19 patients where they were previously billing on a fee-for-service basis, they'll now be billing based on an hourly basis to assist them. We know that there's a problem right now with for them getting paid for the virtual visits. That's part of the way our system is, and that's when the next billing period comes up. So we are working with the OMA once again, because we know there are a number of physicians that are concerned about keeping their offices open, keeping their staff in place, paying their overhead, paying for the machinery and equipment that they have. So we were looking for a solution that is going to work for doctors in Ontario, and we hope to have that solution available very soon. That is something that we're still in discussions with the OMA about it.
Next question.
Next question comes from Siobhan Morris from News Talk 1010. Please go ahead.
Hi, my question is for the Premier. Premier, we heard the federal government say today there won't be a Canada Day celebration on Parliament Hill. It'll be some sort of virtual experience instead. So is it fair for Ontarians to infer then that we'll continue to be in our current state of closure and restriction into July, or do you think we might see some of those stage changes that you've been talking about by July 1st?
Well, that's still a number of months away, a couple months away, and I just want to make sure that we focus on the health and well-being of the people of Ontario. I don't want to jump 2 months ahead. We have a real fight on our hands still. As much as the modeling looked a little positive, it can go the other way. We could see a second stream of this coming. So I'm extremely nervous with predicting anything 2 months ahead. So we'll take it a day at a time and see where we're at closer to July the 1st.
Okay, and I have a question for Minister Lecce too, please. Minister Lecce, you talked about how quickly the distance learning plan came together, but I'm wondering why it seems that it came together in the matter of days that you described today. So by the end of January, we had seen the shutdown of Wuhan. We had cases of COVID-19 in Ontario and all over the world, really. So why did those detailed discussions about learning alternatives not start in January?
Well, our program, actually, the developments and discussions within the ministry happened much before Canada or Ontario called a state of emergency and declared it a global pandemic. We've been acting on this based on the advice of Dr. Williams and the command table for some time. It's why we were able, unlike virtually any other province, to unveil a program, a virtual learning environment within a matter of days. It's why we're able to take 2 million children, perhaps the single greatest transformation in education when it comes to how we teach, within a matter of days. It's why we had a program for the first phase to keep kids engaged in English and French with supports that are accessible for kids from literally kindergarten all the way to 12. We repurposed TVO and TFO, 2 agencies within the Ministry of Education, immediately for all-day educational programming. You know, we did a lot, but I recognize there's more to do. And I think part of our obligation as we look forward to a, quote, post-COVID world is how do we take the actions today, learn lessons, further improve safety, but ensure that no matter what gets thrown at us as a country and as a province, that we could seamlessly pivot to keep learning online and using that capacity and the ingenuity that we have in this province of virtual learning. Right now, we're providing professional development to thousands of educators to do that, to ensure that in schools in September and beyond, if, God forbid, we have to, again, remove students from class, close schools, that it will be done seamlessly. So I think we started early, but I also appreciate that this pandemic and its global speed and the veracity of this problem, the challenges of this pandemic, require us to learn lessons and improve going forward, which is this government's commitment on virtually everything we do.
Last question.
Last question comes from Lisa Shing from CBC News. Please go ahead.
Hi there, everyone. Question for the Premier. We're learning a personal support worker at Sienna Altamont Care Home in Scarborough has died from COVID-19. Her husband is devastated, and we're hearing the workers aren't feeling safe. They're stressed and afraid to go to work and don't feel protected. Why didn't the province act faster to protect these workers?
Well, first of all, my condolences, my prayers and thoughts go out to the family. It's heartbreaking. You hear of these tragedies, and we're doing everything we possibly can, as we've said, to put an iron ring around these homes. And I'll pass this over to my Minister of Long-Term Care, and she'll be able to answer the rest.
Thank you. My deepest sympathies to the family of our personal support worker who has lost her life. My heart goes out to every single PSW on the front lines, everyone who's contributing in this fight against COVID-19. We were active and decisive for months, putting every measure under the guidance of the Chief Medical Officer of Health and Public Health to make sure we took the measures that were necessary. Clearly, COVID-19 is spreading in a different way, and more tools are needed, and that's exactly why we announced our action plan. More staffing, more infection control, more testing, more surveillance. These are necessary going forward. This is a different fight we have on our hands. It truly is a war. And my deepest condolences to the family of the individual who's lost her life.
Thank you. And one more for Minister Fullerton. CBC has another investigation out today about your inspection system. You keep talking about how you shifted to a risk-based system in long-term care homes. How can you defend that system when it failed to catch anywhere near as many problems with infection prevention and control as the previous comprehensive system did?
Well, I'm going to push back on that statement because we have the most rigorous inspection system in all of Canada. 2,800 inspections, 2,800 inspections last year. The 9 RQIs or random quality inspections that are being reported, that is a tiny % of a different type of inspection. And we are doing every serious complaint, every incident, there's an action line for that. And this is something that we are extremely rigorous about. We have multiple layers of inspection, and I think it is unfortunately misleading to the public to present it in that light.
Thank you.
Thank you, everyone.